Hello, good people. This is your girl, Jacqueline Mhonja Ambaka. I'm a nurse by profession, and I'm passionate about nursing, lifestyle, and also travel. If this is the kind of content that interests you, then you're welcome to my channel. Please subscribe. Today being the first ever video for this channel, we are going to talk about 5 important things that someone should know before they embark on the journey of becoming a nurse. Uh, the very first thing I want to say is for disclaimer. I'm not discouraging anyone from becoming a nurse. I'm simply sharing my experiences. These are things that I didn't know, but I wish somebody else knows before they decide to join the nursing profession. So I'm not out to discourage anyone. Okay, so we are going straight to the first point, and landing a job nowadays is becoming quite difficult. Yeah, it's becoming quite difficult. And my fellow degree nurses, you can bear me witness. You can work with your papers everywhere, and practically no organization wants to hire degree nurses because they believe that degree nurses are quite expensive to be hired. So most organizations prefer to hire diploma nurses because they think those are are a bit cheap to and easy to manage financially. So you before I remember before when I joined nursing, I used to hear that once you finish nursing, you're automatically going to land a job, and that is why most people would take their kids for nursing. But that is no longer a reality. Nowadays things are happening differently, and you find that with your papers you will get jobs, yes, but they might not be jobs up to your standard. They might be funny jobs, maybe going to people's clinics to do abortions or something. Or maybe you get a job and you're underpaid, and or you're overworked but underpaid. You're not paid according to your scale. But all in all, what I'm trying to say is it is becoming quite difficult to land a job in nursing as we talk right now. Number two, someone should know that there are other options. When I joined nursing, I knew that the only nursing I'm going to do is the bedside nursing. I'm going to nurse my patients by the bedside, and do their bed baths, dressings, injections, and everything. But what I've come to learn about nursing is quite interesting, that you can do nursing and go away, far away from bedside nursing. You can actually study nursing to become a lecturer. You can also study nursing and specialize in research. And there are very good organizations that support nurses who like to specialize in research, such as the United Nations, the World Health Organization, and also the Cambry. So, nurses, open your mind. Don't be closed minded. There are opportunities out there. Number three on my list is I wish somebody knows or visits a hospital so that they find out about the work environment of a nurse. For your information, the patients spend most of their time with the nurses, like the longest. It is the nurse who stays with the patient. The doctor will come review the patient during the ward rounds and go, but the nurse will stay with this patient maybe from morning to the night. So, for you to be a nurse, you need to have the passion, and having the passion, you will make it. You also need to have the heart. We see different things, and if you're the type who is not able to withstand such things in our ward environment or in a hospital setting, then you might not have the heart to continue with the nursing profession. So sometimes it is also difficult just dealing with the relatives. They are very difficult relatives, and you have to have the grace and the humility to handle such relatives. But what I've said is once you're passionate, then you're definitely going to make it. You have to love nursing with your heart. You have to nurse with your heart ideally. And that is the nursing tribe. That is what we joined. And then something else somebody should know is that no one ever tells you that this is how it feels to lose a patient. No one, absolutely no one will tell you that. But what we are saying is what I'm trying to say is be prepared. Go knowing that you can nurse this patient to recovery, or you can also nurse this patient and also lose the patient. There are these stages of grief that are mentioned in Kubler-Ross stages of grief, but I believe somehow it is very difficult. It is very difficult when you lose a patient. So go through those Kubler-Ross stages of grief, but then just know that it is difficult to lose a patient, especially a patient you've been looking after for quite some time. You leave the patient today stable, you come tomorrow, the patient is gone. It is quite discouraging and it is disheartening. So be prepared for such type of issues. And then be also prepared because nothing is going to impact your life in various ways. Okay, take this example of a newly married couple. You've just gotten newly married to someone and you are on, after, of course, say after your honeymoon, you are supposed to report on duty, you are on night duty. It is very difficult sometimes to balance. You have to go to work, you also have to remain at home. It is very difficult to choose, but be prepared for such. Know that as I choose nursing, I'm also choosing to sometimes be away on special events, on days that are even considered holidays. You might even have to work for holidays, like Christmas. People are out there celebrating, and you're on the job. You might have to do maybe local local arrangement, or maybe talking with your colleagues, to make sure that someone covers you when you're away. Or you can also talk to your in charge ahead of time. And then the last thing I want to talk about nursing is that we learn every day. Everybody learns every day. Every day, something new will crop up. We never stop learning. So you will have to go back to your books. You'll have to do short courses. You'll have to be updated with the current knowledge, and you will have to know, why am I doing this procedure this way? Why not the other way? People are upgrading from certificates, diplomas, and even degrees to masters, just because learning is a continuous process and it never stops. Uh, Thanks for taking time to watch this video. Feel free to add more experiences around nursing that you think one should know before joining nursing in the comment section. Much love, Jackie. Yeah. Sema maneno.